If you haven't heard, measles is back and it's spreading fast.
New numbers show the measles virus spreading like wildfire.
Some new data show the number of measles cases in the U.S. is now higher.
And this week, we actually saw the first death from the disease in this country in 10 years.
And here's what the media is not telling you. In this video, we're breaking down why it's making a comeback, who is most at risk, and how can you protect your family, especially if you live in a community with limited access to healthcare. Stay with me because by the end of this video, you have the knowledge to make a powerful choice about your health. Before 1963, measles was a major problem. Every year, 500,000 cases and 500 deaths were reported. Then came the measles vaccine, and by the year 2000, measles was eliminated in the United States, meaning no continuous transmission for over 12 months. We beat it. But fast forward to today, measles is back. Why? There's two big reasons: vaccine hesitancy and global travel. Importation of cases. Measles is still common in other parts of the world. Travelers who aren't vaccinated bring it back and boom, outbreaks happen. Vaccine hesitancy and misinformation. Some communities fear vaccines because of misinformation. Increasing vaccine refusal in certain communities has led to pockets of under-immunized populations. This is particularly evident in close-knit communities with low vaccination rates, such as the Orthodox Jewish communities in New York, which experienced significant outbreaks in 2018-2019. No, the measles vaccine does not cause autism. Science has proven this over and over again. Impact of COVID-19. The pandemic messed up regular vaccinations, leaving more kids vulnerable to measles today. Have you or someone you know skipped a vaccine because of concerns? Drop yes or no in the comments. Let's talk. Who is at risk? Measles is a highly contagious viral disease caused by measles virus. It is transmitted via respiratory droplets and direct contact, with an incubation period averaging about 11 to 12 days from exposure to the onset of prodromal symptoms. Measles spreads like wildfire. One sick person can infect 12 to 18 others just by breathing. Measles isn't just a rash. It can cause deadly complications, and most at-risk groups are children under age of 5, 90% chance of getting infected if exposed, pregnant women, risk of miscarriage and premature birth. People with weak immune systems, HIV, cancer, and transplant patients are at high risk. And here are the common measles symptoms: high fever, anywhere between 103 to 105 degrees Fahrenheit, the 3 C's, runny nose, which is coryza, cough, and red eyes, which is conjunctivitis. Couplet spots, these are tiny white spots inside the mouth, and this could be an early warning sign, and it may appear 1 to 2 days before the rash. Now the rash, it spreads from the face down to the body and appears about 14 days after exposure, typically appears 1 to 2 days after the onset of fever. You are contagious 4 days before and 4 days after the rash appears. Measles virus can remain infectious in the air and on surfaces up to 2 hours after the infected person leaves the area. Major complications: severe lung and neurologic dysfunctions such as pneumonia and encephalitis. There's a rare condition that can happen which is called subacute sclerosing panencephalitis, short for SSPE, which can be fatal long-term complication which can happen years after initial infection. So how do you protect your loved ones and your family? Get vaccinated. The measles vaccine is 97% effective with 2 doses. Kids should get their first dose or first shot at 12 to 15 months and the second at 4 to 6 years of age. If traveling, check your status. If you're going overseas, make sure you and your kids are vaccinated. If exposed, act fast. If you're around someone with measles, getting the MMR shot within 72 hours can still protect you. Know when to quarantine. If someone in your home gets measles, isolate them for 4 days after the rash appears to stop the spread. Measles serology can be checked if necessary, such as IgM and IgG. However, checking measles serology or offering a booster of MMR vaccine is not recommended if you were born before 1957 because you're likely fully vaccinated or have a previous positive measles IgG. This is a case-by-case situation. Please discuss this with your healthcare provider. Management of measles is primarily supportive, including vitamin A supplementation, which has been shown to reduce morbidity and mortality in children. There There is no specific antiviral treatment for measles. Prevention through vaccination is crucial and highly effective. Finding misinformation and making a change. Let's set the record straight. Vaccines do not cause autism, they do not overload your immune system, but they do absolutely protect you from deadly diseases. If you're unsure, talk to your trusted doctor, not a social media post. Your health is worth real facts. Now that you know the truth about measles, it's time to take action. Leave a comment below. What's one thing you learned today? Let's start the conversation. Share this video with a friend who might need to hear this. Let's work together to keep our families safe. See you in the next video.